every day is a blessing to all of us.
Indeed. I want us to begin from the latest report that we just aired right before we went on break. It was a report by Melita Oletenges. It touched on a number of issues that talked about the healthcare sector in your county. And one of the issues, but we're going to just have a general look at first of all, the healthcare sector in your county. There's this issue of the community healthcare program, the community healthcare volunteers program. It appears to be quite an integral part of your healthcare agenda. Why is it that?
Well, let me say that when you find yourself in a pit, you don't dig further, but you dig yourself out. And that is where we found ourselves in the last 6 years or so. When I came in 2017, the health sector in Tharaka Nithi was in dire need. We were ranked among the worst counties in terms of immunization in this country. Our health workers were perpetually on strike almost every other month, and that is definitely just because of teething problems in devolution. You know, the first term, when the health workers were coming from the national government to the county government, the expectations were very high. They also had unions that definitely were demanding and moving faster than the government themselves. But I'm glad to be serving in the second term when things are a bit settled down, and we had to dig ourselves out of the hole. And what we realized is that if we can be able to curb the diseases at the prevention level, then we will not incur the high cost that usually is incurred during the curative level, which is the treatment. Therefore, in collaboration with development partners, I remember in particular there was Red Cross, there was AMREF, we recruited 1,267 community health workers who were trained, they were kitted, and also given gadgets to report and attached to the nearest health facility. We have a total of 110 households in Tharaka Nithi, which are normally served by 127 units that are usually distributed all over the whole county. When I talk about unit, we are talking about 100 households being served by one community health worker.
Right.
What they do is every day they spend about 2 hours checking on the households in their health status and teaching them on simple methods how to prevent diseases. And because of that, we have been able to see the index in healthcare in Tharaka Nithi going up. The queues in our health facilities are reduced significantly, and that is why we can see those indicators of the ranking that you're talking about. You can't believe it, in around 2016, 2017, only 47% of children below the age of 5 years are receiving immunization in the Tharaka Nithi County.
47% only.
Today we are only second to Vihiga County at 95%, and Vihiga is at 96%. So congrats to my friend Rotichilo, but we are catching up. We are targeting 100% in the next 1 year.
You mentioned this, but indeed